My name is Mary. I am one of the nurses working at Optilase. Before you come for your surgery, you will have already seen your surgeon a couple of weeks ahead of time. And during that appointment, you will have been given some papers that we would like you to fill in and send in to us. We will also order your lens during that consultation. You will also be given an appointment for the surgery and a time to come into the clinic. All this will be sent to you by email. It will also be confirmed by text beforehand. We'll ask you for a health questionnaire that we would like you to fill in before you come for your surgery, just so that we have everything prepared and we are ready for your arrival on surgery day. When you arrive into the clinic at the appointed time of your surgery, you will be greeted at the front desk by our receptionist, and we will confirm who you are and your time of appointment, and you'll be asked to take a seat in the waiting room for a few minutes till the admission nurse comes to bring you in. When the admission nurse brings you in, she will bring you into a room. She will sit you down and we will confirm your date of birth, your information. We will have your lens ready and we will have everything organized for you. We will do some checks then, just like blood pressure, just to make sure that you're healthy for surgery, check your temperature and your pulse. We'll confirm the surgery with you and make sure that you're comfortable to proceed. Once we have all those checks done, we will then bring you into the pre-anesthetic room, which is a little room patients go into just before the surgery. In that room, we will put a little hat on you and little shoe covers, just to keep everything sterile in the operating room. So for the surgery, we operate through a dilated eye. So that's the pupil of your eye that is going to be dilated. And how we dilate your eye is by putting drops into the eye. So we will start putting the drops in while you are in there. We will also explain the surgery and what to expect when you are going to have your procedure. And usually that involves being under a microscope, and you will see a bright light while you're under the microscope. We operate on one eye at a time. So one eye, we have a drape is covering you, but you are still able to breathe. The drape is held above. We have a bar that holds the drape up, and we will put a speculum into one of the eyes, and that is the eye that we are going to operate on. The other eye, we ask you just to keep the eye open, just so that it balances the eyes up. We will put lots of numbing drops into your eye. So they're called topical anesthetic drops, and what they do is they numb the surface of your eye so that you will have no pain at all during your procedure. You are awake for your procedure, and this is important because then you're able to listen to any instructions that the surgeon wants you to follow, as in looking at a light, so that you're coherent, you can understand what he's asking you to say, but you will not feel any pain at all. And we also have extra anesthetic drops that we put in during the procedure so that you won't feel anything. So we'll put all those drops in when you're in the anesthetic room, and then the surgeon will come into that room. You will have already met your surgeon a couple of weeks prior to this date, but during your admission, the surgeon will come into the anesthetic room and he will talk to you. He will confirm your lens, and he will also ask you if you have any questions that you might have thought about between seeing him earlier and your day of surgery. So once you're comfortable with that and you're happy to proceed with the surgery, we will bring you into the operating room. The scrub nurses will come around and they will introduce themselves to you, and they will confirm your details, your date of birth and the surgery that you're having done, any allergies or any medication or anything that you are on. We'll just make sure that you're healthy for surgery. Once you're in the operating room, you will be lying flat on a trolley. So we have the bar across, and the bar will hold the drape up. You're wheeled in onto a drape. We operate in what's called like a little cube, and one part of you is in under the cube. Once we start the procedure, we make sure that your eye is completely numb again. We cleanse the eye, we put drape over the eye that we're going to operate on, and then the surgeon puts a speculum into your eye, and it just holds the eye open. It's just like a little clip. Again, you won't feel any pain at all, but it just keeps the eye open so that you don't have to worry about trying to keep your eye open yourself. Next, you will see the bright light from the microscope. Your eye at this point is dilated, so sometimes people feel that the light is very bright. Within a couple of minutes, you will adapt to the brightness of the light. The surgeon will then start the procedure. To take your natural lens out, that's what we do. We take your natural lens out and we are going to put an artificial lens in. It looks almost like a contact lens, except that it goes right into your eye, so that it's not visible, and it would only be visible if you were sitting in front of under a microscope or in front of a slit lamp. So you can't see it once the lens is in there. So to take your natural lens out, we use a machine. It's called a phacoemulsification machine. What it does is it just breaks up the lens and it sucks it out. Most people say it sounds a little bit like a vacuum cleaner. That just takes about 2 or 3 minutes. And once your lens is out, then we prepare the new lens to put in. The new lenses come completely folded and ready to go into your eye. They go in with a little injector. You may feel a little bit of pressure as the lens is going into your eye, but again, you won't have any pain. A very tiny incision in your eye. It's just millimeters. And what happens is when the lens is put in, it's folded as it's going in, and then it opens up when it goes into the eye. So again, you won't feel any pain, but you may feel a little bit of pressure as the lens is going into your eye. So once the lens is in, sometimes you can see it's like a kaleidoscope, sometimes not because the eye is still dilated. And then what we do is we have a viscoelastic. It's like a gel that we put in the eye to keep the eye inflated while we are operating on the eye. So we need to take that out once your new lens goes in. So that's where there's a little bit of water involved in that. And then once that is out, we just seal the incision. And the incisions are very tiny. We don't use any sutures. It just seals with a balanced salt solution, which is effectively like a sterile water. And then we put a few drops in your eye and the procedure is over. So it takes approximately 6 to 7 minutes per eye. Each operation is treated as a separate operation. So once we have finished the first operation, we will put a shield on your eye. We'll take all the drapes off. The first nurse takes everything away and we give you about 5 minutes to wiggle around a little bit, and then we start on the second eye. And the second eye is exactly the same as the first eye. It will be the same. We'll have more anesthetic drops in. We will cleanse around the eye. We put a new drape on the eye and we start the procedure all over again. So once the second eye is done, then we take all the drapes off. We put a shield on your eye. Then you are brought into the discharge room to recover for about 15 or 20 minutes. We'll get you a cup of tea or a cup of coffee and we will explain all your post-op instructions for you. You will be given a bag with all your drops to take home and clear instructions on how to take all your drops, and we'll check with your follow-up appointment for the next day. We look forward to seeing you on your surgery day, but if you have any questions ahead of time, please get in contact with us. You will have an opportunity to talk to your surgeon again on the day of the surgery, but if there's anything that you think about ahead of time, please contact us. We're here to help you and we're here to answer all your questions.